Dr. Finnis, what can be done to slow down the aging process of the skin?
We essentially have two possibilities. We either prevent the signs, or if we can't, we correct them. So, what are the measures of prevention? What can help us slow down the signs of aging? Personally, I think that the number one factor is the sun. It is the biggest enemy of the skin. The sun has to be avoided 100%, but sometimes it's impossible.
That's true.
So, if it's not 100% possible, other measures should be taken, like putting sunscreen, trying to avoid the sun at its strongest time from 10 in the morning to 3 o'clock in the afternoon, or, for example, putting a hat, etc.
So these are measures for prevention.
There are others also.
Are these other measures for prevention?
Eating well is one of the important factors.
It could have an influence.
Certainly, if we eat well, eat a well-balanced meat, etc., it helps. Sleeping well is another important factor. The body needs rest. And sleeping well gives the face and the body the rest they need. Exercising is an important factor. Even having less stress and seeing life in a more positive way, that too has an effect.
In the end, you need a well-balanced
That's
life.
right.
You were talking about preventative measures, but when it's too late, when we are stressed, when we are taking too much sun, what can be done then?
Then we concentrate on the corrective measures, correcting the signs of old age. We have surgeries like facelifts, eyelid lifts, forehead lifts, facial implants to enhance what age has depleted, etc. Therefore, there are surgical options to repair the damage.
You were talking about the surgical approaches, but what about the milder procedures? Are there other types of interventions with less side effects?
Yes, absolutely. There are skin treatments, such as creams, that are quite simple. Some procedures are a little aggressive, like the chemical peeling, that will renew the outer layers of the skin, or more aggressive procedures such as the laser that takes away the wrinkles. It's like the chemical peel, but is more aggressive and has better results. These are the non-surgical treatments, although the laser is considered by some half surgical and by others non-surgical. There are other possibilities like injections that are less aggressive and are the ones with the lowest risk and shortest recovery time.
What about the risks?
Very minimal.
Not many side effects?
There are temporary injections like collagen, Restylane, Hyaluronic. New permanent injections that are called Article. They're just
out on the market.
Just out on the market. There are also injections that will diminish the undesirable facial expression like Botox. So there are many possibilities.
We hear quite often about Botox lately. What is Botox?
Botox is an injection that weakens the facial muscles of expression. I'm talking mostly about the muscles around the eyes, like the expressions between the eyebrows or on the sides of the eyes, when we are upset, etc. Often people who have these wrinkles are not angry or serious, but appear that way. Therefore, if we want to get rid of those expressions, we can inject Botox. This diminishes the contractions of the muscles, so we look more at ease and more relaxed. It also gives a younger look.